Describe the significance of play-based therapy in pediatric occupational therapy. Explain how play as a therapeutic tool contributes to developmental milestones in children with autism spectrum disorder (ASD. Include considerations for sensory processing and social emotional development. Answer: Play-based therapy is essential in pediatric occupational therapy, particularly for children with autism spectrum disorder, as it provides a natural and engaging medium through which therapeutic goals can be achieved. Play is inherently motivating and enjoyable, which makes it an effective vehicle for promoting various developmental milestones. In children with ASD, play can be structured to facilitate sensory processing, a critical area where many children experience difficulties. For example, therapists may introduce various sensory experiences such as textured toys, auditory stimuli, and movement-based activities, to help children adapt to sensory inputs they may find overwhelming. This approach not only aids in desensitization, but also enhances the child's ability to process sensory information effectively, thereby improving their participation in everyday activities. Moreover, play serves as a context for social-emotional development. Through guided play activities, children are encouraged to engage with peers, practice turn-taking, and share, which are crucial skills for social interaction. For example, when playing cooperative games, children learn to interpret social cues and manage emotions in group settings, fostering their ability to form meaningful relationships. Adult-focused occupational therapy. Why is it important to assess the cognitive demands of a client's work environment when developing a work rehabilitation program? Outline the factors an occupational therapist should consider in this assessment. Answer: Assessing the cognitive demands of a client's work environment is crucial in adult-focused occupational therapy for several reasons. First, it ensures that the occupational therapist can tailor rehabilitation programs to match the client's cognitive capabilities with the job's requirements, promoting successful reintegration into the workforce. This assessment is particularly important for clients returning to work after injury, illness, or cognitive decline, as mismatches can lead to frustration, decreased productivity, and even further health complications. When conducting this assessment, occupational therapists should evaluate multiple factors. These include attention demands, which assess how much focus is required for tasks, in-memory requirements to determine if the client can retain information pertinent to their job and problem-solving capabilities, which are essential for navigating challenges at work. Environmental factors also play a significant role. The therapist should assess the work environment for noise levels, physical layout, and time constraints that may affect cognitive performance. By understanding these cognitive and environmental demands, occupational therapists can develop tailored interventions that enhance cognitive function, improve task performance, and promote job satisfaction, ultimately aiding clients in achieving their vocational goals. Maria is a 75-year-old woman with a recent history of falls in her home. She experiences mild cognitive decline, often forgets to use her walker, and has difficulty organizing her daily routine. She lives alone but receives weekly visits from a family member. Question: what interventions should an occupational therapist consider to help Maria reduce her fall risk and improve her independence at home? Describe how each intervention aligns with geriatric OT principles. Answer: to help Maria reduce her fall risk and enhance her independence, an occupational therapist should consider several targeted interventions that align with geriatric OT principles of safety, functional independence, and client-centered care. Environmental modifications. The therapist should recommend home modifications, such as installing grab bars in the bathroom and securing loose rugs to minimize tripping hazards. Improving lighting, particularly in stairways and hallways, can also enhance visibility and safety. These modifications directly support Maria's physical safety and autonomy in her living environment. Cognitive aids. Given Maria's cognitive decline, the therapist might introduce visual reminders or checklists placed in key areas of her home, e.g., near her walker, to prompt her to use it consistently. These aids would help compensate for her memory challenges, promoting her ability to follow through with safety practices. Balance and strength training. Engaging Maria in exercises tailored to improve her balance and lower body strength is critical. Simple activities such as standing on one foot or stepping exercises can be integrated into her daily routine to enhance her physical stability, thereby reducing her risk of falls. Education on fall prevention. Educating Maria on the importance of using her walker and strategies for navigating her home safely is essential. This might include discussing safe ways to get up from a seated position or how to approach stairs. Empowering her with knowledge about fall prevention allows for greater self-management and confidence in her abilities. By implementing these interventions, the occupational therapist can support Maria in maintaining her independence while ensuring her safety in her home environment. Discuss the role of occupational therapy in addressing work-related stress. Among adults, explain how occupational therapists can support clients in developing coping strategies for stress management in high-demand occupations. Answer: occupational therapy plays a pivotal role in addressing work-related stress among adults, particularly in high-demand occupations where job pressures can significantly impact mental health and overall well-being. Occupational therapists are equipped to assess the unique stressors faced by clients and to implement strategies that foster healthier work-life balance and resilience. One primary approach involves teaching clients effective coping strategies for managing stress. This may include relaxation techniques such as mindfulness, guided imagery, or progressive muscle relaxation, which can help clients reduce anxiety and improve focus. Therapists might also introduce time management skills, enabling clients to prioritize tasks, set realistic goals, and break work into manageable segments, thus reducing feelings of being overwhelmed. In addition to individual strategies, occupational therapists assess the workplace environment for potential stressors, such as excessive noise, inadequate break schedules, or unrealistic workloads. By advocating for ergonomic adjustments or promoting policies that support employee well-being, like regular breaks and flexible hours, therapists can influence workplace culture positively. Explain the purpose of sensory processing interventions for children with cerebral palsy in a school-based occupational therapy setting. Include considerations for physical, cognitive, and social domains. Answer: sensory processing interventions in a school-based occupational therapy setting are designed to address the unique challenges that children with cerebral palsy face regarding sensory integration and functional participation in educational activities. These interventions aim to improve the child's ability to effectively process sensory information, which is critical for their overall development and learning. For the physical domain, occupational therapists may use activities that provide proprioceptive body awareness and vestibular balance and movement input. For example, they might incorporate swinging or climbing activities that enhance muscle tone and coordination, promoting better control over movements during classroom activities. In the cognitive domain, sensory processing interventions help improve attention and focus. Engaging children in sensory-rich activities, such as tactile play with sand or water, can facilitate cognitive engagement by capturing their interest and aiding in the development of problem-solving skills through exploration. These activities encourage the child to think critically and make decisions based on sensory feedback. From a social perspective, sensory processing interventions support social interaction by providing opportunities for peer engagement. Group activities that require turn-taking, sharing, or cooperative play allow children to practice social skills in a structured, supportive environment. This fosters communication and helps children develop relationships with peers, which is vital for their social-emotional growth. Overall, sensory processing interventions in occupational therapy not only address sensory integration but also facilitate holistic development across physical, cognitive, and social domains, enabling children with cerebral palsy to engage meaningfully in their educational setting. What factors should be considered in an OT evaluation for older adults aimed at aging in place? Describe how occupational therapists can tailor interventions to meet the unique needs of aging clients in this context. Answer: when conducting an occupational therapy evaluation for older adults aiming to age in place, several critical factors must be considered to ensure that interventions are effective and client-centered. Physical abilities. Assessing the client's mobility, strength, and balance is vital. This evaluation helps identify any physical limitations that could hinder daily activities and may necessitate environmental modifications or adaptive equipment. Cognitive function. Evaluating cognitive abilities is crucial for understanding how well clients can manage daily tasks independently. Therapists assess memory, attention, and problem-solving skills, as cognitive decline can significantly affect the ability to perform activities of daily living adults. Sensory abilities. Assessing sensory functions such as vision and hearing is also important, as impairments in these areas can lead to safety risks and decreased participation in meaningful activities. Home environment. The therapist should conduct a home assessment to identify potential hazards, such as clutter, inadequate lighting, or lack of assistive devices. This evaluation helps determine what modifications are necessary to promote safety and accessibility. In tailoring interventions, occupational therapists may recommend environmental modifications like adding grab bars or improving lighting, introduce cognitive aids such as calendars or reminders, and implement strength and balance exercises tailored to the client's abilities. Additionally, therapists can educate clients on fall prevention strategies and the use of adaptive equipment to enhance independence in daily activities. By considering these factors and developing individualized interventions, occupational therapists can effectively support older adults in maintaining their independence and quality of life as they age in place. How does occupational therapy intervention support the psychosocial well-being of clients recovering from substance use disorders? Discuss specific strategies used to promote recovery. Answer: occupational therapy interventions play a critical role in supporting the psychosocial well-being of clients recovering from substance use disorders by addressing the complexities of addiction and promoting a holistic approach to recovery. The focus is on enhancing clients' engagement in meaningful occupations, which can provide a sense of purpose and fulfillment, thus supporting recovery. One essential strategy is skills training, which helps clients develop coping mechanisms to handle triggers and cravings associated with substance use. This training can include stress management techniques, communication skills, and problem-solving abilities that empower clients to navigate challenges in their daily lives without resorting to substances. Routine development is another key intervention. Occupational therapists work with clients to establish healthy daily routines that prioritize self-care, leisure, and productive activities. By filling their schedules with positive and fulfilling occupations, clients can reduce idle time, which might otherwise lead to cravings or relapse. Social support is integral to recovery. Therefore, therapists may facilitate group therapy sessions or community activities that promote peer support and connection. Engaging in group activities helps clients build social networks that reinforce their commitment to recovery while providing a safe space for sharing experiences and challenges. Lastly, therapists might utilize mindfulness and relaxation techniques to help clients manage anxiety and stress, which are common challenges during recovery. Mindfulness practices such as yoga or meditation can enhance clients' awareness of their thoughts and feelings, enabling them to respond to cravings with healthier coping strategies. In summary, occupational therapy supports psychosocial well-being in clients recovering from substance use disorders by focusing on skills training, establishing healthy routines, fostering social connections, and incorporating mindfulness techniques, ultimately promoting a successful and sustainable recovery process. Identify the importance of early intervention in pediatric occupational therapy. Discuss how early occupational therapy services can influence long-term developmental outcomes for children with disabilities. Answer: early intervention in pediatric occupational therapy is crucial for optimizing developmental outcomes in children with disabilities. Research consistently demonstrates that the earlier children receive targeted occupational therapy services, the more significant the positive impact on their functional abilities, social participation, and overall quality of life. One primary reason for the importance of early intervention is that children's brains are highly plastic during the early years of life. This neuroplasticity allows for more effective learning and adaptation when therapy is introduced at a young age. For example, children with motor delays can achieve milestones like crawling and walking more readily when they receive interventions that promote motor skill development before age 3, which is a critical period for gross and fine motor skills. Moreover, early occupational therapy services often focus on family involvement, educating parents on strategies to support their child's development in daily routines. By empowering families with knowledge and tools, therapists enhance the home environment support for the child, which can lead to improved outcomes in communication, play, and self-care skills. Additionally, early intervention can reduce the need for more intensive and costly services later in life. By addressing developmental concerns early, children may require fewer resources as they transition to school and beyond, promoting their ability to integrate into educational settings and participate in social activities. In summary, early intervention in pediatric occupational therapy is vital for facilitating positive long-term developmental outcomes, enhancing family support, and reducing the future burden of care, ultimately leading to greater independence and quality of life for children with disabilities. Explain the therapeutic role of activity analysis in occupational therapy. How can occupational therapists use activity analysis to enhance client-centered care and promote participation in meaningful occupations? Answer: activity analysis is a fundamental therapeutic tool in occupational therapy, serving to dissect and understand the various components of activities to optimize client engagement and participation in meaningful occupations. This process allows occupational therapists to evaluate the specific demands of tasks, identify potential barriers to participation, and design targeted interventions that enhance client-centered care. Through activity analysis, therapists can break down activities into their constituent parts, including the physical, cognitive, sensory, and social elements required for successful engagement. For example, when analyzing the task of cooking, therapists would consider the cognitive demands of following a recipe, the physical skills needed for chopping ingredients, and the sensory experiences associated with taste and smell. This detailed breakdown helps therapists pinpoint areas where clients may struggle and tailor interventions accordingly. Additionally, activity analysis fosters a deeper understanding of clients' interests and values. By collaborating with clients to analyze activities they enjoy or find meaningful, therapists can create personalized goals that resonate with clients' motivations. This client-centered approach ensures that interventions are not only relevant but also engaging, promoting higher levels of participation and satisfaction. Moreover, activity analysis can reveal adaptations or modifications needed to facilitate participation. For example, if a client struggles with fine motor skills, the therapist may recommend using larger utensils or adaptive tools to enhance independence and confidence in cooking. In essence, the therapeutic role of activity analysis in occupational therapy enhances client-centered care by promoting understanding, tailoring interventions, and facilitating meaningful participation in daily occupations, ultimately leading to improved client outcomes and quality of life. Discuss how occupational therapists can facilitate community reintegration for individuals with mental health disorders. Identify specific strategies that support engagement in community activities and promote recovery. Answer: occupational therapists play a vital role in facilitating community reintegration for individuals with mental health disorders, focusing on enhancing participation in meaningful community activities that support recovery and social engagement. By addressing the unique challenges these individuals face, occupational therapists can develop tailored strategies that promote successful reintegration. One primary strategy is skills training, which equips clients with the necessary social and vocational skills to engage in community activities. This may include teaching communication techniques, conflict resolution skills, and job search strategies. By enhancing these skills, individuals can navigate social interactions more effectively by fostering confidence in community settings. Gradual exposure to community activities is another essential approach. Therapists might create a structured plan that starts with less challenging activities, such as attending a small group or participating in a hobby class, gradually increasing the complexity and social demands over time. This method helps clients build comfort and confidence in various settings, reducing anxiety and encouraging participation. Occupational therapists also emphasize the importance of support networks, facilitating connections with community resources. Support groups and peer mentorship programs can enhance individuals' sense of belonging and reduce feelings of isolation. By participating in these networks, clients can share experiences, gain encouragement, and develop friendships, all of which are critical to the recovery process. Furthermore, goal setting is vital for promoting engagement in community activities. Therapists work collaboratively with clients to identify personal interests and set achievable goals that align with their values. This goal-directed approach motivates individuals to take proactive steps toward community involvement, reinforcing their sense of agency and purpose. In summary, occupational therapists facilitate community reintegration for individuals with mental health disorders through skills training, gradual exposure, support networks, and collaborative goal setting. These strategies not only promote engagement in community activities, but also significantly contribute to the recovery and overall well-being of individuals navigating mental health challenges. In patients recovering from a spinal cord injury, why is the use of functional electrical stimulation FES considered beneficial in motor re-education, and what principles of neuroplasticity support its use? Answer: functional electrical stimulation (FES) is a therapeutic technique that delivers electrical pulses to paralyzed or weakened muscles, facilitating contractions that mimic natural movements. This intervention is particularly beneficial for individuals recovering from spinal cord injuries, as it promotes muscle activation and coordination, aiding in rehabilitation. FES assists in preventing muscle atrophy, maintaining joint mobility, and improving circulation, which are critical for overall health and recovery in SCI patients. The principles of neuroplasticity play a significant role in supporting FES's efficacy. Neuroplasticity refers to the brain's ability to reorganize itself by forming new neural connections in response to learning and experience. Two key concepts within neuroplasticity are use it or lose it, and use it and improve it. The first principle indicates that neural circuits that are not activated may weaken over time, leading to further functional decline. Conversely, the second principle suggests that engaging in repetitive and targeted activities can enhance neural connections, thereby improving motor function. By utilizing FES in a structured rehabilitation program, therapists can engage patients in movements they might not otherwise perform due to paralysis. Explain the importance of self-regulation techniques in treating patients with bipolar disorder and identify two evidence-based approaches that an occupational therapist may employ. Answer: self-regulation techniques are crucial for individuals with bipolar disorder as they provide tools to manage the emotional and behavioral fluctuations characteristic of the condition. Bipolar disorder is marked by episodes of mania and depression, which can lead to impulsivity and difficulty in maintaining stability in daily life. Effective self-regulation empowers patients to recognize early signs of mood shifts and implement strategies to maintain balance and mitigate the risk of extreme episodes. Two evidence-based approaches utilized in occupational therapy include mindfulness-based cognitive therapy (EBT) and dialectical behavior therapy (DBT). Mindfulness-based cognitive therapy (EBT). This intervention integrates mindfulness practices with cognitive behavioral techniques. It teaches patients to focus on the present moment and observe their thoughts and feelings without judgment. This awareness can help individuals recognize early warning signs of mood changes and develop healthier coping mechanisms. Research has shown that MBCT can significantly reduce the frequency and severity of depressive episodes in individuals with bipolar disorder, enhancing overall emotional regulation. Dialectical behavior therapy (DBT), initially developed for borderline personality disorder, DBT is effective for individuals with bipolar disorder as well. It emphasizes skills in emotional regulation, distress tolerance, and interpersonal effectiveness. Patients learn to identify and cope with intense emotions, which helps prevent impulsive behaviors and enhances their ability to maintain stable relationship. DBT's structured approach provides a supportive framework for individuals to develop essential coping skills that can be applied in various aspects of life. Incorporating these self-regulation techniques into occupational therapy promotes resilience and empowers patients with bipolar disorder to manage their symptoms, ultimately leading to improved quality of life. Ella is a 7-year-old child with autism spectrum disorder who experiences sensory processing difficulties, especially with touch and sound. During a recent family outing, she became extremely distressed in a crowded, noisy area, which led to a meltdown. Her parents have asked the occupational therapist for guidance on how to manage such situations better in the future. What strategies might the occupational therapist suggest to help Ella and her family manage these sensory challenges in community settings? Answer: to support Ella and her family in managing her sensory processing challenges, the occupational therapist could recommend a multifaceted approach that focuses on sensory modulation, preparation for outings, and effective coping strategies. Sensory modulation techniques. The therapist might suggest that Ella use tools to help manage her sensory sensitivities in crowded environments. For instance, noise-canceling headphones can help reduce overwhelming auditory stimuli, allowing her to feel more comfortable in noisy settings. Additionally, fidget toys or weighted vests may provide proprioceptive input, which can be calming and help her feel more secure. Gradual desensitization and exposure. To reduce Ella's anxiety about crowded places, the therapist could develop a gradual exposure plan. This might involve starting with visits to quieter locations where she can become accustomed to being out in public, slowly increasing the level of stimuli, such as moving from a quiet park to a small store, can help her build tolerance and confidence in handling sensory overload. Establishing a safe space. The therapist can encourage Ella's family to identify safe zones within community settings. These could be designated quiet areas or rooms where Ella can retreat if she begins to feel overwhelmed. This strategy allows her to have a plan for self-soothing when anxiety arises. Visual supports. Preparing Ella for outings using visual schedules or social stories can help her understand what to expect. Visual aids can decrease anxiety by providing structure and predictability, helping her feel more in control. By implementing these strategies, Ella's family can create a supportive environment that addresses her sensory needs, ultimately promoting her ability to participate in community activities with greater ease and enjoyment. What are the primary considerations an occupational therapist should evaluate when developing a wheelchair positioning plan for a client with limited trunk control due to a stroke? Answer: when creating a wheelchair positioning plan for a client with limited trunk control following a stroke, the occupational therapist must consider several critical factors to ensure optimal safety, comfort, and functionality. Postural support. Proper postural alignment is vital to prevent secondary complications such as pressure ulcers and musculoskeletal deformities. The therapist should assess the need for lumbar, thoracic, and cervical supports to maintain an upright posture. Stability and balance. Achieving a stable base is crucial for clients with compromised trunk control. The therapist should ensure that the pelvis is positioned in a neutral and stable manner to enhance balance. Utilizing pelvic belts or lateral supports can help secure the pelvis and prevent leaning, which can exacerbate postural issues. Functional reach and mobility. The client's positioning should facilitate arm mobility, enabling them to engage in self-care tasks and other daily activities. It is essential to assess the placement of armrests and the height of the wheelchair to support activities such as eating or using a phone, thereby promoting independence. Pressure distribution. The risk of developing pressure sores increases in clients with limited mobility. The therapist must consider the materials used in seating systems, selecting specialized cushions that promote pressure redistribution and skin integrity. Why is family-centered care crucial in pediatric occupational therapy, particularly when working with children with developmental delays? Answer: family-centered care is an integral component of pediatric occupational therapy, especially when working with children with developmental delays, as it emphasizes the role of families in the therapeutic process. This approach recognizes that families are the primary caregivers and advocates for their children, thus their involvement is critical for successful outcomes. Promotes consistency. By engaging families in the therapeutic process, occupational therapists can help families implement strategies and interventions consistently across various environments, including home, school, and community. This continuity enhances the child's ability to transfer skills learned in therapy to everyday situations. Enhances motivation and engagement. When families are actively involved in goal setting and therapy activities, children are often more motivated to participate. Family members can provide support, encouragement, and reinforcement, which fosters a positive therapeutic environment and enhances the child's learning experience. Empowers families. Family-centered care empowers families by involving them in decision-making processes. This collaboration allows families to voice their concerns, preferences, and insights, fostering a sense of ownership over the therapeutic journey. As families gain knowledge and confidence, they are better equipped to support their child's development. Holistic approach. This care model acknowledges the unique strengths, needs, and values of each family, leading to more individualized and relevant interventions. Therapists can tailor their approaches to align with the family's cultural background and daily routines, ensuring that therapy is meaningful and practical. By prioritizing family involvement, occupational therapy can significantly improve outcomes for children with developmental delays, fostering not only their skill development, but also enhancing overall family dynamics and well-being. Mr. Gonzalez, a 45-year-old man with schizophrenia, frequently misses his occupational therapy sessions due to anxiety about leaving his house. He has expressed a desire to improve his ability to manage daily routines, but struggles to initiate tasks. What interventions might the occupational therapist implement to address his needs while considering his mental health condition? Answer: to support Mr. Gonzalez in managing his anxiety and improving his ability to engage in daily routines, the occupational therapist could implement several targeted interventions that address both his psychological and practical needs. Graded exposure therapy. This intervention involves gradually increasing exposure to feared situations. The therapist can collaborate with Mr. Gonzalez to create a hierarchy of tasks he finds anxiety-provoking, starting with less challenging activities and gradually moving to more difficult ones. For example, initial goals may include stepping outside for a brief moment before progressing to going for a short walk around the block. This gradual exposure can help him build confidence and reduce anxiety over time. Task breakdown and visual supports. To assist Mr. Gonzalez in initiating tasks, the therapist can employ a task breakdown strategy, simplifying routines into smaller, manageable steps. Visual schedules or checklists can be utilized to provide clear guidance, helping him track his progress and maintain motivation. For instance, a checklist for morning routines may include steps such as brushing teeth, making breakfast, and taking medications. Mindfulness and relaxation techniques. Teaching Mr. Gonzalez mindfulness practices such as deep breathing exercises or guided imagery can help him manage anxiety during challenging moments. These techniques provide coping strategies that you can use before leaving the house or when feeling overwhelmed. The therapist can integrate mindfulness into his therapy sessions to encourage regular practice, community engagement, and peer support. Connecting Mr. Gonzalez with local support groups or community resources can foster social connections which may alleviate feelings of isolation and anxiety. Encouraging participation in structured group activities can enhance his social skills while providing a supportive environment for managing his mental health. Through these interventions, the occupational therapist can help Mr. Gonzalez develop coping strategies, enhance his independence, and ultimately improve his ability to manage daily routines while addressing his mental health needs. Discuss how an occupational therapist can use activity analysis to improve work-related skills for clients returning to work after an injury. Answer: activity analysis is a critical tool for occupational therapists when working with clients returning to work after an injury. This systematic process involves breaking down tasks into their constituent components, enabling therapists to identify specific areas where clients may face challenges and develop targeted interventions. Identifying task demands. The first step in activity analysis is to evaluate the physical, cognitive, and emotional demands of work-related tasks. The therapist assesses the environment, tools, and materials involved in the job to understand what skills are required. This evaluation allows the therapist to pinpoint the essential skills needed for task performance and identify any modifications that may be necessary. Determining client abilities. Once the task demands are identified, the therapist assesses the client's current abilities and limitations post-injury. This assessment includes evaluating physical strength, range of motion, endurance, cognitive functioning, and emotional readiness to return to work. By comparing task demands with client capabilities, therapists can identify gaps that need to be addressed. Developing interventions. Based on the findings of the activity analysis, the occupational therapist can design customized interventions. This might include work hardening programs, tailored physical rehabilitation that simulates job tasks to gradually increase the client's strength and endurance, skill retraining, focused exercises to improve specific skills necessary for job performance, such as fine motor skills for assembly work or cognitive exercises for roles requiring attention to detail. Ergonomic modifications, recommendations for workplace modifications to accommodate the client's limitations, such as adjustable workstations or adaptive tools, evaluation and feedback. As clients engage in these interventions, ongoing evaluation is essential. The therapist should gather feedback on the client's progress, making adjustments to the treatment plan as necessary. Regular check-ins with the client and their employer can ensure that the rehabilitation process aligns with workplace expectations and facilitates a smooth transition back to work. Through the application of activity analysis, occupational therapists can create comprehensive and personalized plans that enhance clients' work-related skills, support their recovery, and promote successful reintegration into the workforce. What factors should be considered when developing a home exercise program for a client recovering from total knee replacement surgery? Answer: when developing a home exercise program for a client recovering from total knee replacement surgery, the occupational therapist must consider various factors to ensure the program is effective, safe, and tailored to the client's individual needs. Post-operative status. The therapist should assess the client's current physical condition, including pain levels, range of motion, swelling, and overall mobility. Understanding the stage of recovery is crucial in selecting appropriate exercises. Functional goals. The therapist must establish clear, realistic functional goals in collaboration with the client. These goals should be specific, measurable, achievable, relevant, and time-bound. SMART, such as walking a certain distance or performing specific daily activities independently. Safety considerations. Ensuring the safety of exercises is paramount, especially in the early stages of recovery. The therapist should provide detailed instructions on proper techniques to prevent injury. Additionally, recommendations for environmental modifications, such as removing tripping hazards and ensuring adequate lighting, can facilitate safe exercise practice at home. Client education and engagement. Educating the client about the importance of the exercise program in their recovery process fosters engagement and compliance. The therapist should discuss the rationale behind each exercise and how it contributes to functional recovery. Encouraging clients to maintain a positive mindset and focus on gradual progress can enhance their motivation. Progress monitoring. The home exercise program should include provisions for regular reassessment and progression of exercises. The therapist can establish a schedule for follow-up appointments to evaluate progress, modify the exercise plan, and address any concerns the client may have. By considering these factors, occupational therapists can develop effective home exercise programs that facilitate recovery, promote independence, and improve overall outcomes following total knee replacement surgery. How can occupational therapists address the unique needs of older adults with cognitive impairments, and what strategies can be implemented to enhance their engagement in daily activities? Answer: occupational therapists play a vital role in addressing the unique needs of older adults with cognitive impairments, focusing on enhancing their engagement in daily activities to promote independence and improve quality of life. The following strategies can be implemented. Person-centered approach. Understanding the individual's history, preferences, and routines is essential for creating meaningful and engaging activities. Occupational therapists should conduct thorough assessments to gather information about the client's interests and previous occupations. Cognitive rehabilitation techniques. Implementing cognitive rehabilitation strategies can help improve specific cognitive skills affected by impairment. Techniques such as memory training, attention enhancement exercises, and problem-solving tasks can support cognitive functioning. Activity simplification and modification. Occupational therapists can modify activities to match the cognitive capabilities of older adults. This may involve breaking tasks into smaller, manageable steps or using visual supports such as checklists and picture cues. Routine establishment. Establishing structured daily routines can provide predictability and stability for older adults with cognitive impairments. Therapists can work with clients to develop consistent schedules for activities of daily living, adults, and leisure, helping them maintain engagement and independence over time. Incorporating technology. Utilizing assistive technology can enhance engagement for older adults with cognitive impairments. Tools such as reminder apps, electronic calendars, and simplified communication devices can support memory and organization, allowing clients to participate more fully in their daily lives. Family involvement. Engaging family members in the therapeutic process can provide additional support for older adults. Therapists can educate families about strategies to promote engagement and participation at home, creating a supportive environment that fosters independence. By implementing these strategies, occupational therapists can effectively address the unique needs of older adults with cognitive impairments, helping them maintain engagement in meaningful activities and enhancing their overall well-being. What role does collaboration play in ensuring effective pediatric occupational therapy interventions for children with sensory processing disorders (SPD), and what strategies can therapists employ to enhance this collaboration? Answer: collaboration is fundamental to effective pediatric occupational therapy interventions for children with sensory processing disorders (SPD). This teamwork approach enhances the overall effectiveness of therapy by incorporating insights from various stakeholders, including caregivers, educators, and healthcare professionals. The collaborative process ensures a comprehensive understanding of the child's needs and promotes a consistent implementation of strategies across different settings. Shared goal setting. Collaborative goal setting is essential for ensuring that therapy objectives align with the child's daily environments, such as home and school. Involving caregivers and teachers in the goal-setting process helps ensure that the interventions are relevant and targeted toward the child's specific challenges. Consistent implementation of strategies. When caregivers and educators are actively involved in the therapy process, they can apply sensory strategies consistently across environments. Regular communication and feedback loops. Effective collaboration necessitates regular communication among team members. Occupational therapists can establish structured check-ins with caregivers and educators to share observations, updates on progress, and strategies that have been effective or need adjustment. Training and education. Therapists can enhance collaboration by providing training sessions for caregivers and educators on sensory processing and effective strategies. Educating these stakeholders about SPD and its impact on the child's functioning can empower them to support the child more effectively, creating a more informed and cohesive support network. Multidisciplinary team meetings. Regular multidisciplinary team meetings can facilitate collaboration among various professionals involved in the child's care, such as speech therapists, physical therapists, psychologists, and special educators. These meetings provide opportunities to share insights, address challenges, and coordinate efforts to ensure a holistic approach to the child's therapy. By fostering collaboration among caregivers, educators, and other professionals, occupational therapists can create a comprehensive support system that addresses the unique needs of children with sensory processing disorders, ultimately enhancing their engagement and success in daily activities. Explain the principle of occupation as a means and an end in occupational therapy. Why is this principle central to the philosophy of OT, and how does it influence client-centered practice? Provide examples of its application in practice. Answer: the principle of occupation as a means and an end is foundational to occupational therapy, rooted in the belief that engaging clients in meaningful occupations can lead both to therapeutic improvement as a means and to achieving the desired functional outcome as an end. This principle underlines the concept that occupations, meaningful daily activities, are both tools used for therapy and goals to be achieved by the therapy process as a means. Occupations are used as therapeutic tools to improve specific skills or abilities. For example, a client with limited hand mobility might engage in pottery as a therapeutic activity to improve fine motor skills, even if pottery is not their ultimate goal as an end. The occupation itself is the goal. For a client who wants to return to cooking independently, the therapy focuses directly on enabling them to regain the specific skills and adaptations needed for cooking. In client-centered practice, this principle helps therapists to design interventions that are deeply meaningful and aligned with the client's personal goals, making therapy more engaging and effective. Which occupational therapy model focuses on the interaction between the person, the environment, and the occupation, and emphasizes the dynamic relationship among these components? Discuss how this model guides assessment and intervention. Answer: the person-environment-occupation (PO) model emphasizes the interaction between the individual, person, their environment, and their occupations. This model views occupational performance as the outcome of these interactions, highlighting that a change in any of the three elements affects overall performance. Person: the model considers the individual's physical, emotional, and cognitive capacities. Environment: it includes the physical, social, cultural, and institutional elements that either support or hinder occupational performance. Occupation: it examines the activities and tasks meaningful to the person and how they are organized over time. In assessment, the PO model guides therapists to evaluate the client's abilities, analyze environmental factors that support or limit performance, and understand the task's demands. Interventions are then designed to optimize the fit among these components, such as modifying the environment to reduce physical barriers or adjusting the occupation to align with the client's capabilities. Emma is a 58-year-old office worker who has recently been diagnosed with rheumatoid arthritis. She experiences joint pain and stiffness that significantly impact her ability to perform daily tasks, including typing at work and cooking at home. Based on the rehabilitative frame of reference, what strategies should Emma's occupational therapist consider to enhance her occupational performance? Answer: the rehabilitative frame of reference focuses on enabling clients to achieve their highest level of functioning through adaptation and compensation, despite physical limitations. Adaptive equipment: the therapist could introduce tools to reduce joint strain, such as an ergonomic keyboard for typing or jar openers for cooking. Energy conservation techniques: Emma could learn pacing strategies, such as taking breaks during tasks, to manage fatigue and joint stress. Joint protection techniques: education on joint protection, such as avoiding excessive force and using larger joints to carry items, could minimize joint damage. Environmental modifications: adjusting Emma's work environment, like positioning her computer and chair to promote ergonomic alignment, can reduce strain on her joints. Task simplification: simplifying tasks or reorganizing her routines, e.g., preparing meals in batches, can help her complete daily tasks more efficiently. These strategies align with the rehabilitative frame's goal of maximizing independence through adaptation, enabling Emma to participate in meaningful activities despite her condition. Describe the concept of occupational justice and its significance in occupational therapy. How does this concept guide interventions aimed at addressing social inequities in healthcare? Answer: occupational justice is the belief that all individuals have the right to engage in meaningful occupations that enhance their well-being, regardless of social, economic, or physical conditions. This concept highlights the therapist's role in advocating for fair access to occupational opportunities and addressing barriers that prevent individuals from participating fully in life activities. Occupational justice underpins interventions that seek to eliminate occupational deprivation, lack of access to meaningful activities due to external factors like poverty or discrimination, and occupational marginalization when societal norms limit certain groups from engaging in specific occupations. For example, therapists working with marginalized populations might focus on community-based programs that improve access to educational and recreational opportunities. This approach not only benefits individual clients but also promotes broader social equity, addressing disparities that impact occupational health. What is the importance of the AOTA Code of Ethics in guiding occupational therapy practice, and how does it influence decision-making in ethical dilemmas? Discuss the application of one principle in a hypothetical case. Answer: the AOTA Code of Ethics establishes the core ethical standards for occupational therapists, providing a framework for professional conduct and decision-making. It helps therapists uphold integrity, respect, and responsibility, ensuring that clients receive fair and effective care. One key principle is beneficence, the obligation to promote the well-being of clients. In practice, if a therapist encounters a case where a new experimental treatment might improve a client's health but carry significant risks, beneficence requires the therapist to carefully weigh these risks and prioritize the client's welfare. Ethical decision-making in such dilemmas involves assessing potential benefits and harm, consulting with the client and relevant stakeholders, and considering alternatives, always aligning with the client's best interests. In the model of human occupation MOHO, how are volition, habituation, and performance capacity defined, and how do they interact to shape an individual's occupational engagement? Answer: volition, habituation, and performance capacity are central components of the model of human occupation MOHO, explaining how people are motivated, organize their lives, and perform tasks. Volition refers to a person's motivations, interests, values, and beliefs about their own abilities. It drives individuals to choose and persist in activities. Habituation encompasses habits and roles, which organize behavior into routines. It provides a structure for how tasks are accomplished in daily life. Performance capacity refers to the physical and mental skills needed to perform tasks, as well as the subjective experience of one's abilities. These elements interact dynamically. For instance, strong volition may encourage someone to adapt when faced with limited performance capacity, while habituation provides the routines needed to maintain consistency in tasks despite fluctuating motivation or ability. How does the Canadian model of occupational performance and engagement, CMOPE, incorporate spirituality, and why is it considered a unique element within this model? Answer: the Canadian model of occupational performance and engagement, CMOPE, includes spirituality as a core component, defining it as the essence of a person's self and source of meaning in life. This inclusion is unique because it acknowledges that a person's sense of purpose and meaning is integral to occupational engagement and well-being. Spirituality influences an individual's choices, motivation, and goals in life, making it a vital part of client-centered care. In practice, therapists working within the CMOPE model might explore clients' spiritual beliefs to better understand their motivations and aspirations, tailoring interventions that respect these deeper values. This approach promotes holistic care, aligning interventions with what clients find most meaningful in their lives. Mr. Davis, a 72-year-old client, has been diagnosed with Parkinson's disease and has difficulty with fine motor tasks, including dressing. Using a biomechanical frame of reference, outline an intervention plan to improve Mr. Davis's dressing ability. Answer: the biomechanical frame of reference focuses on improving clients' physical capabilities, particularly strength, range of motion, and endurance, to enhance their functional skills. Strengthening exercises incorporate exercises to strengthen Mr. Davis's upper limbs, especially those muscles involved in grasping and reaching, joint mobility and stretching. Daily exercises targeting joint flexibility can reduce stiffness and improve range of motion for dressing tasks. Adaptive dressing techniques educate Mr. Davis on techniques that simplify dressing, such as using larger buttons or Velcro and dressing aids like button hooks. Environmental modifications consider adjusting Mr. Davis's environment, such as using stable seating for dressing to reduce fall risk. This intervention plan aligns with the biomechanical approach, enabling Mr. Davis to perform daily dressing more independently by improving physical function and compensating for limitations. Jessica is a 40-year-old woman with a history of anxiety and depression. She has recently experienced a significant life change after losing a job. As her occupational therapist, what strategies can you implement to help her improve her occupational engagement and manage her mental health? Answer: to support Jessica in improving her occupational engagement and managing her mental health, a holistic approach incorporating therapeutic activities, goal setting, and coping strategies can be utilized. Establishing routine. Help Jessica create a structured daily routine that includes time for self-care, job searching, social interaction, and physical activity. This can provide a sense of normalcy and predictability. Goal setting. Collaborate with Jessica to set realistic and achievable short-term goals related to her occupational interests, such as volunteering or pursuing a hobby. This can enhance her motivation and give her a sense of purpose. Mindfulness and relaxation techniques. Introduce mindfulness practices such as deep breathing or meditation to help Jessica manage anxiety and increase her awareness of the present moment, promoting emotional regulation. Skill development. Encourage participation in workshops or online courses to develop new skills that can boost her confidence and employability. Learning something new can also serve as a distraction from negative thoughts. What role does the concept of client-centered practice play in occupational therapy, and how does it differ from traditional therapy approaches? Discuss its implications for therapist-client relationships. Answer: client-centered practice is an essential philosophy in occupational therapy that emphasizes collaboration between the therapist and the client, prioritizing the client's needs, preferences, and goals throughout the therapeutic process. Differences from traditional therapy approaches include focus on the client's perspective. In client-centered practice, the therapist actively involves the client in decision-making and respects their insights into what is meaningful for them. Traditional approaches may rely more on the therapist's expertise, with less emphasis on the client's input. Collaborative goal setting. In a client-centered approach, goals are co-created, ensuring they align with the client's values and interests. Traditional approaches may impose predefined goals based on standardized assessments without considering individual client circumstances. Empowerment and autonomy. Client-centered practice fosters client autonomy, encouraging individuals to take ownership of their recovery process. This contrasts with traditional methods where clients may feel passive or dependent on the therapist. Implications for therapist-client relationships include trust and rapport. Establishing a trusting relationship is vital as clients feel heard and validated in their experiences. Increased engagement. Clients are more likely to engage actively in their therapy when they feel their voices matter, resulting in better outcomes. Flexibility. The therapeutic process is more adaptable, allowing for modifications based on client feedback and changing needs. Ultimately, client-centered practice enhances the therapeutic alliance and promotes a more effective, personalized approach to occupational therapy.